Welcome to the Frontline Herbalism podcast with your host Nicole Rose from the Solidarity Apothecary. This is your place for all things plants and liberation. Let's get started. Hello, welcome back to the Frontline Herbalism podcast. I hope you've had a chance to listen to the first couple of episodes in this series all about the politics of trauma. The first one was with my partner Rob, all about trauma and addiction, and the last one was with an amazing abolitionist and delinquent, capital letters, Ayana Goodfellow, about their book Innocence and Corruption, exploring like youth oppression, age trauma, child abuse, like all sorts of things, and how we can support young people. I thought it was really amazing and moving. I really wish I was joining their upcoming workshop that we mentioned in the episode, but I've got a prison visit, sadly. But yeah, so this episode today is with my close friend Amani. She is an amazing human being who speaks regularly about chronic illness and kind of living with chronic illness, and we explore kind of chronic illness and trauma. So we talk about medical trauma, some of her like explicit experiences of kind of challenges like medical gaslighting and, you know, neglect and bad treatment by kind of people working in healthcare, and how kind of things like hospitalisations become kind of normalised for friends and family, but for the person, you know, are continuously traumatic. We just go deep. It's a very moving episode. We talk about prejudice around chronic illness, some of the kind of bullshit attitudes a lot of people have, you know, in this kind of like positivity, new age mindset stuff, and how that harms people. You know, we talk about support and solidarity, and how people living with chronic illness are also amazing friends and also offer a lot. And that it's not just this kind of like one-way dependency street. But yeah, we just really go there, and I'm really grateful to Amani for being like so vulnerable and honest about her experiences. I think there is a lot of wisdom and also, you know, enraging things too around the medical industrial complex and the systems we're living in. But I hope you find it helpful. I'm sure like a lot of people who sort of engage with the Solidarity Apothecary have experiences of chronic illness. It's definitely something I had for several years before kind of, you know, doing my clinical training and understanding what was really going on in my body and addressing kind of chronic inflammation kind of, and coming out of that maze with a lot of support. But yeah, I know it is a very, you know, very, very common experience for many people, and we don't talk about it enough. And yeah, like I said, I'm just grateful to Amani for opening up so much and sharing her experiences. So yeah, please let me know how you find the episode, what you think about it. And again, just shameless plug, my Herbalism, PTSD and traumatic stress course is coming this Friday. Very excited about it. So yeah, a lot of the stuff that me and Amani talk about, we explore in the course. Like I talk about things like kind of common trauma dynamics, like what makes particular experiences kind of particularly traumatizing. And we look at things like disability justice and like healthism in the course as well, and just some of the kind of political context of our experiences. So anyway, please check that out. I'll put the link in the show notes. And yeah, thanks again to Amani. And yeah, let me know what you think of the episode. Oh, and also, yeah, I guess just, yeah, you probably got the impression from this introduction, but just, I guess, content warning, like we do talk about like medical things and also some near-death experiences. And yeah, I think there's also references to psychiatric imprisonment. Okay, thanks everyone. Hey Amani, thanks so much for coming on this show. As people maybe don't know, we're actually like really long-term close friends, and I really adore you. You've been an incredible friend to me for so many years now. But for folks who don't know you, like please could you introduce yourself, your pronouns, and kind of like any like political affinities or projects or anything you'd like to include.
Thank you for that nice intro. I love you to bits, first of all. And I'm very honoured to be on this podcast because I'm a big fan of your work. In terms of my pronouns, there's she, her, and an intro about me is that, like, I guess I've been political like all my life. I grew up like super, into social justice with my mum, and then obviously carried that on. And I feel like that, like, I can't work at the moment and I haven't worked for a long time. So I think it's easy to feel like you're not contributing enough, but I feel like I do all I can through like social media and stuff like that, and like projects through social media is like how I try to make a difference. And with my health issues that we'll talk about in a minute, I feel like that's my sort of way of contributing to society, I guess, if that answers your question.
Yeah, that's amazing. I mean, like, yeah, I think you do loads of stuff like to support people like all the time, and you know, loads of that is invisibilized, right? But yeah, for people who don't know you, I know it's a very long story and you've been through a hell of a lot, but if you could just share a little bit for context of kind of what your experiences have been with chronic illness, that would be amazing.
Yeah, so I've actually lost count of how many chronic illnesses I have, which is kind of like the joke when you have chronic illness, like you kind of collect conditions, and that's definitely been my experience. I would say I probably have like 12 or 13 like hardcore conditions, like that involve, I just as an example, like I have things like rheumatoid arthritis, like a brain injury, endometriosis, heart condition, POTS, in surgical menopause, have lots of problems with my bladder and bowel, like I have to catheterize every time I pee, and I'm waiting for a permanent suprapubic catheter. Have problems with my kidneys. And then obviously, like also in terms of mental health, I struggle with complex PTSD due to like childhood trauma, and then recently got diagnosed with high masking autism, and I'm waiting for my ADHD assessment, but pretty guaranteed I've got that. So that's just a little summary. Yeah.
Sorry, I'm almost like stunned to silence of like, how does that feel to you in daily life? Like, what does that kind of look like for you?
Yeah, good question. So I guess most of my life is spent in bed, and that's obviously a complete head fuck in itself. Like you never get used to that. Like people, of course, you get used to how to deal with it, but you never get used to that, especially when you're someone like me who like loves life and just wants to like eat life all the time, and always have been. And before I got sick, I was like just doing so much all the time. And so my life is spent, I would say like 95% horizontal. And the times when I'm upright, it's not like it's because I'm better. It's because maybe I have like, you know, my pain has gone from a 9 out of 10 to an 8 or 7 out of 10. You know, it never goes below that. So, you know, I sort of, do my best to do something nice with the times I can be upright. And that's something a skill that you learn because you have to with years of chronic illness, is to push through to your detriment, but in order to support your mental health, if that makes sense. So anyway, so my days are spent mostly in bed, with like debilitating fatigue and like muscle weakness and dizziness, and then like the severe pain. I didn't used to struggle as much with pain, but then I think sort of over the like last 8 years, like that's been the worst symptom for me. It's just, I wouldn't wish it upon my worst enemy. And I've often got, you know, like the trouble with chronic illness is people are immunocompromised, and I'm on low dose chemo for my arthritis, and I'm already immunocompromised, and that makes me more so. So I obviously deal with a lot of like acute illnesses on top of the chronic illnesses, which is just a bit of a mess, to be honest. Yeah, so that's how my days are spent. But I do get nice, you know, little bits where I manage to go for a swim sometimes, or, you know, but the trouble is that all the life responsibilities fall away. You know, I just don't do them. My flat's a mess, like life admin's a mess. I can't keep on top of those things, because if I've got at all the capacity to leave the house, I will, to get some fresh air, to see friends, like for half an hour, and then I'm back to bed. So yeah, that's a long-winded answer.
Oh, bless you. And like, you used to be like a sort of outdoor education, like extreme sports instructor, right? Like back in the day.
Yeah. So yeah, I used to teach like water sports and like sort of outdoor pursuits. And I loved it. And I was like an athlete, like second in the country for javelin when I was 16. I always like showing off about that. Just like, you know, I was always captain of all sports teams. Like I did sports at uni, like sport for social change at uni. Did lots of work in communities and stuff with that. And like, you know, I was really set on a cool path, if you'd say, like with what I wanted to do with my life. And obviously that all came crashing down quite epically. I would say back in the last year of uni, basically. So when I was like 23, 22. Yeah.
And I think you've described it before, like, or I know when I had chronic illness for like a few years with my ribcage stuff, it was like a full-time job, like going to appointments and going to hospital and then recovering from that time in hospital and ordering supplements, and like that constant, like relentless journey of like trying to get different diagnostic assessments and like labels and advocating for medication you need and all of this stuff. Like it's like a lot of energy, right?
100%. And I think people, like I say to people who, you know, you obviously understand that part, but like a lot of people I know who don't have chronic illness, like just, I say it's a full-time job, but I can see in their sort of face, they don't quite get it. And you're not going to get it unless you've been through it. Like I do understand, but I find that a very lonely part of chronic illness, because people are like, you know, I once had a therapist who I quite quickly sacked, but he was like, oh, I wish I could stay in bed all day making art. As though, like, and I've had people say things like that to me. Like that's not what happens. I make art about like once a month. Secondly, like staying in bed I would give anything to have a busy, stressful job, or like have, you know, some sort of situation. Like everyone has like challenges, like, but I would give anything to like be overwhelmed with busyness, or like have, you know, things I have to do. Like all the things I have to do are surrounding my health, and you get completely burnt out. And I'm sure we'll cover that. But like, you know, you can only advocate for yourself for so long before you get burnt out. And when you're navigating, like, you know, 12, 13 health conditions, all with a different consultant, like, constantly battling the medical system, which again, we will cover, like, but the kind of people have no idea the strength and exhaustion that is like, happens when you have to, make all the phone calls, emails, chase up, and then also obviously going to the appointments, having to deal with the emotional aftermath of being gaslit and dismissed and treated like shit, and whilst living in severe pain and being at the bottom of your capacity to cope. But yet every single day you have to wake up and cope. You know, you don't get people, just as an example, like I take a lot of like pain relief, so like opiates and stuff, because of my pain. Unfortunately, I have to. But people think that means that like I get pain relief. Like that's not how it works. Like you never have when I take pain relief, my pain maybe goes from like a 9 to an 8. Like it's never that much. And I think people think that you have periods of time when you feel okay, and that's why you go and do something, and then periods of time when you're ill. Like that's, for some people that is how it works, but for people like me, I never feel okay. You know, I was saying to someone the other day, like, I am never okay. Like, and that's horrible. It's really hard. Like, and I think one of the biggest misconceptions about people with chronic illness is, when we're being open about it and we're talking about it, is that we're being negative. And that's one of my biggest peeves about people misunderstanding chronic illness, is that we are some of the most positive people that you will ever meet, because to have to wake up every day and face what we face and still remain like basically alive and on the planet, like, you know, and also able to keep up some friendships or relationships. And obviously not everyone can do that when they have chronic illness, but, you know, I'm very proud of myself that that's very important to me. So I put a lot of energy into my relationships when I can. But, you know, I'm sort of waffling, but basically I just struggle when people misunderstand us as being like negative when we're being honest about it. And because we're never all right, like we never have reprieve from our symptoms. So it's a very hard life to live. And it's just, I wish people would understand that when we talk about it, we're just trying to, when someone says, how are you? And if they actually want to know, my answer is always intense. Like it's always hard, but that's not because I'm negative. It's because I'm just trying to be honest about my experience, if that makes sense.
Yeah, 100%. And like, I think people also just like don't comprehend like the grief, right? Of like I think it was interesting about your past in terms of like the outdoor education work and stuff, because it's like, I think there's so much prejudice around people with chronic illness that they're kind of choosing it, or like that they're in a pattern and that's their thing or something, or it's become part of their identity. I remember having a massive argument with this teacher at a herb school who was kind of saying that like it was problematic when people developed an identity relating to their illness, like, oh, I'm a Limey, like I've got Lyme disease. And I just kicked off and was like, people need social support and validation when they're chronically sick. And I really don't think people are choosing anything. Like, I think it's something that people are surviving with and developing mechanisms to cope with. But yeah, I know I've got loads of other questions about all sorts of things, but just before we move on to that, I just wondered if you could share a little bit about that kind of like daily experience of grief, like around your own body and yeah, how you're feeling.
Yeah, I mean, like, just to respond to what you were just saying, I'll talk about grief in a minute, but like, something I really struggle with is when people are like, don't let your illness stop you, don't let your illness become who you are. And it's like, it is part of me. Like, I'm not letting it stop me. Like, it's not a choice. And it's just everything you said, like, is so spot on. And I think often you find people in the kind of positive thinking world or the holistic health world, like, not obviously hashtag not everybody, but like, you get a lot of people who completely misunderstand that. And I think until you've lived in the shoes of someone with lots of chronic illnesses, you can't have an opinion about that kind of thing, in my opinion. But in terms to answer about grief, yeah, so I sort of refer to it as like a living grief. So like it's very hard to describe, because again, until you sort of lived it, you can't explain. It's hard to explain about how painful it is to watch your friends, your peers, live their life and have these kind of, like I said, everyone has challenges, but their challenges, I'd give anything to have their challenges, like, and the grief of that, watching people, just as an example, I had a hysterectomy and a oophorectomy. So I had my ovaries, fallopian tubes, cervix, and uterus removed in 2021. And I don't think, even if I hadn't have had a hysterectomy, I don't think I would probably, I doubt I would have been well enough to have kids anyway. I wouldn't want to have kids in this ill state. But, that grief as an example, that's absolutely huge. Every single day, watching most of my friends create families, a family that I've always wanted. And then, that's like one part of the grief. And then there's also the grief of just like this sort of loss of the life that you thought you were going to live and still want to live. And like, I'm kind of naturally like a hopeful person. And something that's very hard with the sort of chronic illness, the reality of chronic illness, when you have like degenerative and sort of long-term conditions that aren't ever going to go away. And that's not me being negative. That's just the reality of them. Of course, they ebb and flow and they might improve a little bit, but they're always going to be there for my life. And the chances are they are going to get worse. That is such a head fuck. And when you're naturally sort of like a hopeful person, to then have to actually face the reality of that and grieve sort of ever getting better, because people have this thing, people can't fathom that a young person can get sick and isn't going to get better. And like, I can't really even fathom that. And that's me. Like, and I think with the grief, like, there's something that helps me a lot is like just being so kind and gentle with myself. And it's very hard. But I've learned a lot, especially since my hysterectomy. I've sort of learned that a lot more within the grief, to sort of be gentle with myself. And if you feel all the sort of sticky emotions like resentment and jealousy and anger, and you're like, no shit, you feel like that, like, and let yourself feel it. And I think that I used to fight it, and I used to try and pretend that I wasn't grieving, and I used to try and pretend that I was like, this is my life, I sort of would try and put like a fakely positive spin on it and be like, I think I used to see it as a phase, and now it's been like nearly 15 years. I'm like, oh shit, it's not a phase anymore, and I need to face the grief like a bit more. And I think when you live with chronic illness, like quite severely, like as in, when you spend most of your life in bed, you live much more, it sounds weird, but like you live much more in the moment than most people. And I know everyone says that's a good thing, like live in the moment, but actually it can be at your detriment but it's kind of out of absolute necessity. So I don't think about the future, because if I did, I would jump off a cliff. Like I think, and I know other people with like severe chronic illness, sort of degenerative conditions, say the same. Like you live so much in the moment, and that's all you can do to survive, because you're in pure survival state. So speaking of, like that fight or flight, like you're and the trauma that comes with chronic illness, like you're in such a survival state, just coping with severe pain or symptoms every single day, that you don't have room to sort of feel the emotions of like the future and stuff. So all you can do is be with the grief that's in this moment and deal with this moment. And I think, to go back to the grief, like something I feel like my peers who don't have chronic illness just like don't, not a criticism at all, but like they don't understand the grief and how massive that is, and like how incredible it is that those of us with chronic illness keep going, because actually that grief is so painful and just like horrendous to feel, and you rarely can really talk about it other than with obviously people with chronic illness themselves, but like therapy and stuff, like I've spent a fortune educating therapists about chronic illness. Like it's very hard to find support with that grief, I think, other than just within the community. Sorry, that was a long answer.
No, it was a really beautiful answer, and I'm like proper like tearing up. Yeah, I think people just have no comprehension of like that physical journey in terms of like pain and stuff, and then just like not that it's a separate thing, like I don't believe in sort of quote unquote mental health, like I think it's all connected, but that kind of emotional impact of like all of the things you've shared of how it feels like day to day, it's really full on. And I guess that does lead to the sort of the big question of the interview of like how do you think chronic illness is like connected to trauma, like in general?
So I guess like sorry, I'm just thinking. So my belief, like, okay, so I've got a lot of things to say about this. So my brain's firing in every direction. So firstly, I just feel like I need, for anybody listening that has chronic illness, that have been told it's in your head, like that is not what I'm saying. And I think I always want to give that disclaimer, because there's a lot when you struggle, when you've had chronic illness for a long time, and particularly like undiagnosed chronic illness, like when you're looking for a diagnosis and trying to find a diagnosis and trying to get help and support, sadly, heartbreakingly, and it makes me very angry, like we will come across a lot of people, whether it's regular people or medical professionals, that will say something along the lines of, it's just anxiety, it's in your head, like, oh, you've got trauma, like, oh, that's what it is, to completely dismiss I don't want to separate like mental and physical, but the physical condition that you're trying to get support with. So I just like really want to acknowledge that. So that's not, so I'm always hesitant to sort of almost have this conversation, because I never want to sound like that's what I'm saying. But my belief with it is that, say, take me, for example, like I grew up with severe childhood trauma, like proper hardcore, like from 3 years old, well, probably earlier, but from when I remember 3 years old, all the way until I cut contact with my mum and dad, like when I was 24. So that I didn't struggle fully bedbound struggle with my health until I was 23. Obviously, when you look back, you're like, oh, actually, that started a lot earlier, and I just thought it was normal, and I was just trying to cope with what was going on at home, and I didn't tell anyone, and all those things. So it actually started earlier than that. But I wasn't crippled with it until I was 22, 23. So that's a long time. That's like, well, my whole lifetime of being in a really acute fight or flight traumatized state. And that's so stressful on the body. So like that severely stressed out state that I was in, no shit, I got ill. Like, and that's not me making like excuses or making it up or like any of the things that some people like to say. Like, that's just a physiological sort of response to no, like you can't be in that level of stress and your body not sort of almost give out is the wrong phrase, but like collapse. Like, and I also have, I think I have a lot of like genetic sort of, I don't know what the words are, but like lots of illnesses in my family, basically, like in terms of emotional and physical, like all of it, like a lot of history of health problems. And so I think that, my susceptibility was higher anyway, even if I hadn't have gone through a lot of trauma. But put those two together, it's not a surprise that I struggle in the way that I do. But then the unfortunate thing is that, the trauma being so severe, it's not like I can sort of, for example, cut contact with my family and then the trauma just goes away because I'm out of the situation. The irony with PTSD, like post-traumatic stress, particularly like complex post-traumatic stress, like I hate that title, but you know what I mean, like long-term developmental trauma, is that once you're out of the situation as much as you can be, that's when you're actually almost in a more of a traumatized state because you're, in quotations, like safe to feel all the symptoms and have all the symptoms there. And, it's not, when I was younger and dealing with all the trauma, my body was in that fight flight state in survival, but I didn't have like PTSD. I wouldn't have been diagnosed at all. And I wasn't diagnosed until I was 23. And I was stepping back from it all and started to have my own breakdown and crash. So I'm not entirely sure if I'm making sense, but I feel like people misunderstand, well, just take, again, my situation, for example, like that because I'm stepped back from my family, that means that I'm okay now. And it's like, I've dealt ever since I was 24 and I cut contact, like my symptoms of trauma in my body and my mind have been gnarly as fuck and have only just begun to sort of settle slightly because I've been doing long-term EMDR work on the NHS, which is amazing. And I'm so grateful for that. But that 15 years or however long that is, I can't do maths, like, is like, it doesn't surprise me that my conditions have got worse during that time. And I've collected other health conditions because even though I'm not in the trauma situation itself anymore, like my body is still processing the trauma. Like my body is still traumatized as shit. And it's still, it was a lifetime of trauma, like up to 24 years old. Like it's going to take a long time and it'll take a while to sort of release that and settle that. And I kind of believe, not in a negative way, but I believe it's sort of a lifetime's work. Like I don't think that you can have that much trauma and then just suddenly be all right. Like, and I think it doesn't surprise me that over this, since starting to try and heal my trauma, I've gotten more and more sick because the trauma in my body is still flying around in my body. And, I think I'm going to stop waffling on, but like, does that make any sense?
Yeah, no, it makes like 1,000% sense. And like, I think, yeah, like in my herbalism, PTSD and traumatic stress course, like there's a whole module about like how trauma shapes the body. And there's like, these kind of acute responses of someone being in like, for example, fight or flight as a reaction to something. And then there's the like, what happens if that kind of physiological reaction, which is meant to be a very short-term life-saving mechanism, like in nature, becomes like a chronic thing that's, and it does lead to like system collapse, right? Like to kind of degeneration in the body of, like I think that's partly why I couldn't recover from my costochondritis with my ribs, is because you need the adrenals and the endocrine system to be functioning to repair cartilage. And if you don't know what this sort of parasympathetic system, like nervous system state is, where you can actually, find out what rest feels like, then, you're just not going to get anywhere. And yeah, it wasn't until lots of kind of support and self-education and stuff to kind of understand what that feeling meant. But yeah, I think, and I really loved the fact that you gave like a disclaimer at the beginning, because I think, you know, like we do live in this like hideous capitalist society where all sorts of things are in our environments, like switch on certain chronic illnesses, right? Like cause chronic inflammation, whether it's smoking or, you know, something genetic or it's pollution. Like there's all these factors. And I think it's often just this like cocktail mix of different things going on. And I think trauma and that kind of nervous system response is like a major formative thing. But like, you're right, like it's not the only thing, right? And yeah, one, you know, things always kind of like cascade. But in terms of like obviously there's like how trauma contributes to like long-term chronic illness, and then there's this other part of like what is traumatizing about being chronically ill and interacting with the medical system. And I know, you know, we've been like close friends long term, and it's been really hard to see you sort of in and out of hospital like over the years. And I just wondered if you can share like a little bit about what sort of medical trauma is, like specifically. And yeah, maybe this does connect to the next question, but like, you know, I've said about friends, like seeing you kind of go in and out of hospital, and that's become very like normalized, right? Of like, okay, Amani's in hospital. But for you, it's like each time is like more difficult and more triggering because of previous hospitalizations, but everyone around you is kind of like, you know, like it's like Amani's in hospital. Do you know what I mean? Like, anyway, we've talked about this before, but I just wondered, yeah, if you could speak to that too, about, yeah, just like how it kind of feels like being in that system and some of the harm from, you know, gaslighting from doctors or other experiences in hospital. I know you've had a lot of challenges where people have all this prejudice around like pain relief and have had to call the hospital and like fight really hard to get you more pain relief and stuff because of like people's like horrific attitudes and stuff. Anyway, I'm rambling now, but I just wondered if you could share a little bit about like medical trauma in general.
Yeah, I mean, I was nodding along the whole time you're talking then, like, and obviously, you know, like my story. So just to like, before I talk about medical trauma, like just to give a sort of vague history of my experience with hospitals, like, well, it sort of all started when I was younger. My mum had very acute medical conditions and then also was in psychiatric hospital a lot. So I grew up being her advocate. So that's relevant because I already had like post-traumatic stress from my mum, looking after my mum and navigating that sort of, you know, every month or two, like she was in and out, and I would be there like navigating all the time. So I learned that. So I had that. And then I first, you know, the main time I started going to hospital was basically from sort of 2016. I started to go to hospital every single month for quite long periods of time, as in like not just like a night. It would be sort of, it all started with a 3-week stay in 2016, and then I was going in every month for at least like 8 or 9 days. And then this period of time right now is the longest time I haven't been in hospital. So I haven't been in hospital since February this year, and that's the longest time since the summer of 2016. And I, you know, September, that's February, like that's not that long. So I through the pandemic, I was going in every month. Like I just, not for always the same condition, like, but for lots of different things. But yeah, so I've been in hospital as an inpatient a lot. And like you said, you know, like when I first was going in, it was so interesting to me. When I first went in for that 3-week stay in 2016, I had like 1 or 2 visitors every day for 3 weeks, which is incredible. Like I didn't even realize I knew that many people. Like it was amazing. And then I was in every month. I think I had a few, you know, after about 6 months, I just remember like on the 5th or 6th day, I was like, I probably had, you know, I was in for like, say 8 or 9 days. Like I probably had 1 or 2 visitors. And obviously that's better than nothing. But I remember like really noticing, like I'm now a lot more I wouldn't say used to that because it's horrible and really painful, but I kind of expect that because that's what happens every single time I'm in and out, in and out. But when it first happened, I was just like, what is going on? Like, where is everybody? Like, because what happens is like when you first go in, it's a crisis. So everyone's like, I'm there, like, oh my God, you know, like, I'm going to help. Like, what can I do? Like, I'm going to come and visit you because this isn't normal, you know, for you, you know. And I think that's the misconception, is people sort of, then when you keep going in and out, people just think you've got used to it, and see it as your normal. And just because it's my normal in quotes, that doesn't mean it's okay. That doesn't mean I can cope with it. And the biggest, oh my God, it drives me nuts. Like, the biggest misconception and misunderstanding is that the more you go to hospital, the harder it is. So I have friends who have been to hospital for, whether it's like a kidney infection or something acute, and they're like, oh my God, like, obviously it was hard, but like, oh, the staff were amazing. They were so nice. And almost kind of gaslighting me, because they know how much I bang on about how terrible I get treated in hospital. I'm not saying every single member of staff, like, you get the odd one that's amazing, but 9 times out of 10, I get really, really mistreated, and it's traumatic as fuck. And I'll talk about that in a minute. But people, when you have acute illness, you're treated literally like you couldn't be treated more differently in hospital. And of course, you get these stories of dismissal and neglect all the time, like with acute illnesses, but you don't get the head fuckery as much as when you go in with chronic illness. You know your body, you know what you need, you know what's going on, and they just cannot handle that. And I'm never an arsehole. Well, I sometimes can be an arsehole if they're being an arsehole, but like, you know, most of the time I'm actually very polite with it, like, because I know how to work them. You have to stroke their ego. The medical professionals, like, you have to stroke their ego, you have to be so polite, you have to, oh, it's a complete art, and I've got it down. But even though I've got it down, like, it doesn't mean I'm going to be treated well, and that they can cope with me knowing what I need and knowing what's going on and knowing what I don't need and all this stuff. And I think that their egos, like, I'm talking generally, like, obviously, like I said, not everybody, but 9 times out of 10, like, a doctor or nurse's ego, like, can't cope because of the system they're working in and they trained in. They cannot cope with a patient knowing what they need, because they take it personally, as though I'm saying they don't know what to do. And that's never what I'm saying. You know, it's like, oh, it's exhausting. And you get the occasional doctor or nurse that's like, oh my God, this is great. You know, you're doing my job for me. That's amazing. And that's just such a breath of fresh air. But it's actually very rare that happens. And so like, with medical trauma, like, you have the obvious trauma that is the physical invasiveness of being in hospital. You have no personal space. Even if you have a room on your own, which I normally do because of my immune system, you don't have, I know it sounds silly, but people just barge into your room at any point. And for me, I think I've now learned that that's partly with the autism stuff and my trauma history, but also there's something about that you've got no agency. And I think that's a very, shit example, but when everyone just barges in, like, you've got no sense of agency or space or respect, or it's just the little things, like if someone knocks on the door and then walks in, you're like, oh, they actually respect me, and then you've got that, and then you've got the invasive tests, and you've got the like, the whole world has seen my vagina thousands of times. Like, it's just like ridiculous. Like, I have to have a catheter like every time I'm in hospital, and I have to be catheterized or whatever. Like, so that's a problem I've had since 2015-16. I've had a lot of indwelling catheters. So everybody's up in my vag all the time, like, with medical students just stood around me. Like, initially it was always like in acute moments, so I would just take it and I'd just be like, whatever. But I have like sexual, like, assault PTSD as well. And so obviously that's like very triggering. Now I do it myself. So I put in an indwelling catheter in myself, because I'm just like, I'm doing, like, fuck off. They don't like that, but I refuse to let them do it. And if I can, I do it myself, obviously not always. But so you have I've had such horrendous, like, physical medical trauma, like, whether it's nearly dying, like, I've nearly died of sepsis twice in 2 years, in 2020 and 2021. And that's obviously, that for me, that's kind of nothing. Like, that's what I'm used to. But obviously, like, it's not nothing. It was severely traumatic. I was like 2 hours away from dying the first time, like, in resus, like, being, they were like amazed I was okay. And I wasn't, but like, as in, I survived. And I've nearly had proper kidney failure like 6 times in a year and a half, like, all those kind of things. And like, just the little things of like, well, they're not little, but the constant daily things of, for example, it doesn't sound like anything, but having your blood taken for someone like me is incredibly traumatic, because I've got veins, what they've said, I've got veins worse than a cancer patient that's been on chemo for years, because of, everyone always thinks I've like, not that it should matter, but I get called out as like I've done IV drugs a lot and stuff like that. And that shouldn't matter. Like, even if I had, I shouldn't get judgment. But people, as soon as they see my veins are so bad, they don't believe I've been in hospital that much. So they're just like, oh, right, yes, she must have like used a lot. So, and then they just treat me like shit, which is, first, that's fucked up for its own reason. Like, it shouldn't matter my history, but also I haven't. And it's just like the misunderstanding that having really shit veins, it sounds stupid, but like, the trauma of like, when I go for my bloods, which I have to do every 2 to 4 weeks, it takes so many attempts. And now they have to take it, if anyone's squeamish, don't listen, but they have to take it from the thumb knuckle or my feet. Like, and when I have a cannula, like, it's always in my foot. And like, it's just all those things. If it was one time, it would be horrible, but I deal with it. But it's a cumulative trauma. So it's like constant, it's over and over and over again. And the head fuck with medical trauma, which I think people don't understand, the sort of psychological impact of it, is that you need it. So normally with trauma, it's like needs the wrong, like, you don't need it, if that makes sense. That sounds very weird, but like, it's a horrible event that happens. But with medical trauma, it's a horrible event that happens, but you need it. So you have no choice but to put yourself through it, because either you're going to die if you don't, or you're going to be even more sick, or they're going to treat you like you don't want to get better, all of those things. And I think that, that's a huge part of medical trauma. And I have a lot of that, but I have to keep going. I have to keep going back to hospital. I have to keep going back for my bloods. Like, I have to, I inject myself like every week with this low dose chemo for arthritis. And I mean, that's not a big deal for me, but to somebody else, like, it would be. But, you just have to keep doing it. You have to. And that's a big head fuck. So you have that side of medical trauma. But then you also have the emotional side of medical trauma, which does not get talked about enough at all and gets completely overlooked, which actually for me, and this is saying something considering how much physical medical trauma I've had, like going to hospital all the time and dealing with the medical professionals and the gaslighting, dismissal and neglect that I've received, that is much more traumatic than the physical medical trauma. And that really is saying something, because of how much physical trauma I've had. So I have medical PTSD, which I would say most people with like long-term severe chronic illness with going into hospital a lot, people, they have it too. It's a very common thing within the chronic illness world, unfortunately. But I would put money on it that people would agree with me that it's the mental side of things that is more likely to give you that PTSD than, well, obviously it's both the physical and mental treatment, but that's what I feel anyway, from my experiences. It's the emotional side of things that is more of a headfuck and traumatic. So, for me, when I first started to go to hospital, I actually thought they might help me, which sounds very naive now, but I was like, I had this experience, I had a lot of experience of being dismissed with doctors, but I thought, surely if you're like in hospital and they're admitting that you need enough help to be in hospital, that they would want to help. I couldn't have been further from the truth. It's not that all doctors are assholes. It's just that they don't want to listen. They don't have time. Like, they are stressed out of their mind. They like just don't want to hear your experience, basically, because it doesn't fit with their textbook and they don't have the capacity to sort of listen, is from my experience. So I've got so many stories. I don't even know where to start with the medical gaslighting, dismissal and neglect. But as an example, like, I have a long-term condition with from a back injury when I was co-steering. So I was like jumping off really high cliffs into the sea, and I compressed the vertebrae in my back, 2 vertebrae in my back, from a very high jump. And then later, the next year, I prolapsed to the 2 discs. I then had symptoms of a condition called cordial equina, which is very serious condition. And if you have the symptoms, which for me were numbness around the saddle area, like around my buttocks, and I was losing control of my bladder. And if you have those, you have to go straight to A&E. Like everybody knows it, like in, you know, the medical world, like that's what you have to do. So I went to A&E 5 times. And each time I was told it was anxiety and attention seeking that I was going. I couldn't feel my butt. Like I was wetting myself. I was 24 or 25. And I, like every single time, was just told it was anxiety and attention seeking. So I gave up. So I went home. 2 years later, over that time, I started to like not be able to pee properly. I stopped losing control of my bladder, but it went the other way. So I started to struggle with peeing. Didn't think anything of it. And then fast forward a couple of years, I stopped being able to pee completely. And that's when the catheter journey started. So I now catheterize every time I pee. I have indwelling catheters a lot. I'm waiting for a catheter through my just below my belly button for permanently. All this could have been avoided if they'd operated when I went to A&E those 5 times. I was later, you know, a few years later, I was diagnosed with neurogenic bladder and bowel, which is when cordial equina is not picked up and not operated on. That's what you're left with. So people with spinal injuries and stuff like that will have, if they're not able to be treated, like it's neurogenic bladder and bowel. So I've been told I'm going to have kidney failure at some point. I'm going to have this, probably a urostomy, which is a bladder removal at some point. I will have a colostomy bag at some point. This all could have been avoided if they listened to me. And that's obviously quite an extreme example of like the neglect and dismissal. So those things happen when you're actually full on neglected quite severely. But then you have the times when, for example, the second time I had sepsis, I knew what was going on. I was in an ambulance. I was also bleeding because I was in chemical menopause, which confused everybody and threw them off. So every single person I came up against for 2 days were like, oh, it's just endometriosis. It's just endometriosis. They weren't even taking my bloods. And finally, on the gynae ward, they eventually took my bloods and were like, oh shit, it's sepsis. Everybody, like the paramedic, the nurses, the doctors, weren't even giving me pain relief because they were just saying I was an opiate seeker. I was just being dramatic because it was just endometriosis. Like, this is literally their words. Like, I have had that told to me endlessly, that it's just endometriosis, or it's just your pain, or you just have to get used to it, or stop being dramatic, or essentially saying you're a woman, get over it. But obviously they don't say that outright, but they may as well be. I'm going to wrap this up now because I could talk about it forever. But I think that what needs to be understood is that the constant, like every day, if at least like, you know, every day, every week of my life, like I'm battling the medical system, the gaslighting, the dismissal, the neglect. It just royally fucks with you, and it makes you feel so insignificant, so like you don't matter. And when you've had a history of severe childhood trauma that already told you that, you know, like in terms of through that experience, I really learned to believe I didn't matter. I wasn't worthy. Like I had no place in the world. Like my needs didn't matter. I then am facing that every time I'm in hospital, every time I talk to a doctor who doesn't believe me. So friends are like, oh, you know, how did the appointment go? And I'm like, they've got no idea that that's all behind it when I'm trying to answer that question. Like people just think it's just an appointment. And when you have chronic illness and you're in hospital a lot, it's never just a hospital stay. It's never just an appointment. It brings up all of this shit all of the time, and it's just fucking exhausting. And I will stop there. Sorry.
No, please don't apologize. Like that, yeah, it was so like fucking moving. And yeah, I love the like, not all doctors are assholes, but like, yeah, I know. I know that they can really feel like assholes a lot of the time. And we're gonna kind of get to some questions about like what people can do differently. And I was gonna ask you about that, about like what can sort of health workers do differently. But before we go into that, yeah, I know it's like really a lot for you to share in terms of like all this painful stuff. But I know there was recently this horrific piece in the Daily Mail, which kind of targeted different people with chronic illnesses, like without their consent, like sharing pictures, screenshots of social media. And it was just, yeah, it was just kind of amplified sort of especially right-wing views, but society's views around kind of chronic illness. And I just wondered, like, what are your experiences of like prejudice with chronic illness? Like, I guess kind of more broadly, like you've given lots of examples from friends and things and from healthcare workers, but yeah, is there anything you'd like to share in terms of just kind of like society's worldview on chronic illness?
Yeah. So, yeah, obviously with the Daily Mail article, and then obviously that horrendous Candace Owens picked it up to her like 4 million viewers. Oh my God. And I was, one of the people in the article, and that they talked about, and it was all about that we're making up our conditions and illnesses and taking selfies to get attention on social media. And I think that that's a very big world sort of view, like misunderstanding of, just as an example, like social media. So like for me, social media is like my connection to the world. It's amazing. Without it, I could not, I don't know how I would cope. It's a way to find people that are living with similar conditions, young people that aren't getting better either or are getting worse and are dealing with hospital a lot, have medical PTSD, like all of the things that I struggle with. There are people out there too, but not in my daily life. I'm in my like sort of in-person life. And so social media is incredible for our mental, like emotional health and, all of it. Like, and I think that there's a big misconception just generally in society that, that we're making this up, like that we want this. Yeah, it just blows my mind. Like I can hardly even say it out loud, like that we want this, makes me so angry I could cry. Like that this is a choice, and that this whole like ableist narrative of like that thing I was saying earlier, like don't let your illness stop you, like this woman or like person had these conditions and ran a marathon and didn't let it stop her, as an example. Like that's obviously amazing if someone does that. I can't do that. That's not because I'm weaker or I'm choosing not to or I'm choosing this. It's got nothing to do. Like people can have the same condition. This is something that gets misunderstood a lot. Like people can have the same two conditions and have same conditions. Same two people can have the same conditions, like, and have completely different experiences of it, And I think that people, basically, I sort of refer to myself as like a walking discomfort trigger. And because people in our society, we live in such a like quick fix society, very, very, oh my God, ableist society. People just want you to be better. And it's sometimes out of care, but sometimes just like out of ignorance. Like people just want things to be okay, just want to move on, just want to fix things. People can't, not everybody, obviously, like some people are amazing at this, but a lot of people can't sit with the discomfort that's triggered in them when someone like myself shares my experience and story. And I think that that's due to our like fast paced, like ridiculously, like the bullshit, like toxic positivity, like just everything. And then obviously also to like talk about the misogyny and like fucking sexism in healthcare and in the whole world. But like, the whole thing of like, women's pain is so much more dismissed than men's, and then you've also got like the opiate crisis that's got a lot of press recently, sort of over the last few years, like and I think that I've noticed a massive increase over the last 8 years of going to hospital a lot. I've noticed over the last sort of 3 years, a huge increase in people saying I'm an opiate seeker, as in medical professionals saying I'm an opiate seeker when I'm trying to get pain relief, when I desperately need it, when I'm in 10 out of 10 pain and I've literally have been passing out from pain in front of doctors, and they've been like, right, let's just get you, you're obviously an opiate seeker, let's just get you to a taxi before you pass out and send you home. Like, no joke. Like I've had that multiple times, like, and I think that's like, there's a massive misconception around opiate use. And of course it has problems, like, of course, but there's some of us that really need it in order to literally cope with our pain every day. And I think there's just the ableism within our world means that there isn't space for people like myself to kind of be as honest as I want to be about my experience, because people can't cope with it. And I understand, like, no, obviously I understand it's hard to accept that this is a reality of life, but like death is a reality of life that we have to accept. like, well, we don't have to, but like it would be easier if you did, you know, like death is a reality, like chronic illness is a reality, like sexism, racism, ableism, it's all unfortunately part of our life. And like when we actually learn to like face it and have these tough conversations, people feel seen in a way that they don't if we don't do that. Does that make any sense? Sorry.
Yeah, no, 100%. Like, yeah. And I think you're totally right about people's discomfort with seeing someone else kind of suffer, which I think in some ways is like a very human thing, that we want to help people, right? Like we respond to things that we see are oppressive or, you know, harmful to people. But at the same time, like I do think there is something about this like surrendering with chronic illness of like some level of acceptance while holding space that like you're still, you know, investigating new treatments and trying new medications and advocating for yourself in different ways. But it's like, yeah, it's that like horrible tension of like not putting that like ableist pressure. Like I know when I was sort of sick, it was really like, I mean, it's also just my personality. Like I was so driven constantly to try everything, you know, like, oh, I'm going to go to this guy, I'm going to go to this guy, I'm going to borrow money for that appointment. And it was like, actually, I only really recovered when I actually surrendered and was like, I'm just in chronic pain. Like, I don't know what's going to help. And it was the slowing down that enabled me to learn all this stuff about parasympathetic and everything that kind of changed my life. But I think you're right. Like, I think it is, you know, on the other side of the fence, like it is really painful, like seeing people you really care about just being like really debilitated, right? But yeah, you're also right that it's just, you know, like, you know, the majority of people have some sort of illness, right? Like in terms of if you look at humans, like over their lifetime, like, and kind of aging and different conditions and things. And it's like, yeah, like in the herbalism and PTSD course, I talk a little bit about like healthism. And, you know, you say like, what is health? And you think about this like skinny white woman running or something, for example, drinking a green smoothie. Like you don't actually think about health more broadly. Yeah, like sorry to ramble there as well, but I guess I just wanted to kind of, yeah, honor the fact that we've been talking a long time and it must have taken a lot of energy, like emotional energy, to share all this stuff. But just kind of like moving towards like what can people do in terms of like what support or solidarity has like been meaningful to you like over the last 15 years, you know, maybe things that friends have done or organized. And also like what, you know, lots of people that listen to this podcast hopefully are people working in healthcare in different ways. You know, I know there's a lot of like independent herbalists, but there's also people, you know, who are working in hospitals and different healthcare settings. And I just wondered like, what could they do differently, you know, to make you feel more of a human and more listened to and respected and stuff, like during a hospital stay, for example. Yeah, and if there's any other kind of like political solidarity or anything that would kind of, yeah, that you'd like people to do or to think about, if that makes sense. Sorry, a million questions at once.
No, it's okay. Feel free. I will probably forget some of those questions. So like, feel free to ask me again in a minute when I had a ramble. But first of all, like, I think just answer your last question is like something I like, this is obviously a whole episode in itself, but something I really struggle with is the accessibility within activism, like within activist circles. And I know that I'm not alone. So like the ableism within activism is something that's very hard when you're someone like me who is desperate to contribute like politically with activism and everything, you know, like, and obviously I do what I can, but there's actually very little I can do, and I could do a bit more if it was possible, if that makes sense. So that's obviously a massive conversation, but I just wanted to acknowledge, you know, whether it's I just wanted to acknowledge that, whether it's, you know, like people who are holding an event say that, like, you know, you can bring a chair or a beanbag, or people who are running a project say that of course you don't need to come to meetings, you can join through Zoom and do some of the admin on your computer in your bed, you know, like, or have shorter meetings, or I don't know, it's just like it might sound all obvious and like people do that already, but they actually don't. And I think, or if they do, it's kind of like too much of an effort for them. That sounds really bad, But from my experience, like, of course, I've experienced like people that are really like welcoming and want to include me and make me feel sort of like able to join in. But there are, unfortunately, there's not enough sort of like awareness, I feel, from my experience, and that's just where I can speak from, of sort of the ableism within activism. And I think we've all got room for improvement in everything in life, but I think that would be something that I would love to sort of see more conversations of, and I'm sure they happen, but like, I've been part of them, but I just want that a bit more, I think. And in terms of what medical professionals can do to help, like when I think of the doctors and nurses that have been the best for me, like something I come up against a lot is when I'm having a moan about a horrible experience in hospital, people will sometimes respond with like, oh, but they're so understaffed and overstretched. And so don't get me wrong, like, of course I understand that. Like, I have obviously loads of empathy and compassion for that because I'm in hospital all the time. I see the, desperate state the NHS is in. But the hospital staff, whether it's doctors or nurses or even healthcare assistants and stuff, like the ones that have made me not be traumatized from my stay, they haven't taken any more time with me than someone who's been an asshole or unhelpful or whatever, or actually re-traumatized me. So if that makes sense, like it's not that I'm asking for more time or more energy from them when they're already overwhelmed and understaffed. Like the difference is sort of remembering that you're not just remembering that the patient isn't just a piece of meat, that you're like, we are a human. And I know that might sound really obvious, but it's not. I understand why it happens, like within hospital, you're so busy, you're just like bam, 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 having to get through all the patients. But the difference with doctors and nurses who I don't feel traumatized by, and I feel actually genuinely cared for, is when they listen to me and like I think it's respect, actually, like have genuine like respect for my experience and have like the ability to be, I guess, humble, like, and know that perhaps they don't know the answer. Like the best thing, I know that sounds weird, but the best thing a doctor or nurse can do is say, actually, do you know what? I don't know. Like there's this misconception that we want doctors to know everything. And I feel sorry for doctors to have that pressure that I think some people do want the doctors to know everything, to have all the answers, but just the reality of life is they don't. Nobody does. So to have a doctor say, I don't know, I'm going to get back to you, or I don't know, what do you think is going on, for example, is like so huge. It makes me trust them. It makes me feel safer. Like it makes me feel respected and listened to. So that's just like one thing that people in the medical world can do. And I think another thing that in terms of sort of like more like holistic practitioners and stuff like that, and like herbalists and people in that kind of field, something that I've struggled a lot with, like I don't see anybody anymore, sadly. Like I want to start again, but I got quite, like you described, like I got very burnt out when I was sick for the first probably like 7 years or 8 years. I was hardcore with the diets, with the supplements, with the tinctures, with the appointments, with the body work, like all of the things I tried, and I got completely burnt out, like you described. And I've had to have a break from all of that. But I think something that I do struggle with within, whether it's herbalism or naturopathy or whatever, like whatever it is that isn't sort of like Western medicine, like I struggle with, like, there's a lot of people that have declined working with me because I'm too complex. Obviously, I want them to say no if they feel overwhelmed by my situation, but there's a way of doing it. You get burnt out trying to find practitioners. So if someone feels like they can't work with you, I just wanted to say, like, if you feel too overwhelmed by someone's story and their medical situation, it's just the way you can deal with that rejection of that person is so key to their journey. Like, I've just had such awful experiences of people either trying to help me, then realizing they're in over their head and then just treating it so badly. So like we all need to set boundaries, and like I don't want someone to treat me if they feel like it's too much, because that's not helping anybody. Like I want them to say no, but it's the way you say no. And it's also sorry, I'm saying a lot of things, but like something else that's really helpful is to drop the judgment about people taking medications. Like, it's just, I have no time for it. Like, I just get livid with the judgment of like people that it's not about choosing to go down the medicine route, like medication route. Like, I don't have a choice. Like, well, of course, I mean, I could not, but I would be even worse off. Like, so I have had a lot of judgment when I've been trying to find practitioners to support me with like other aspects of my health. Like, I feel like there needs to be more understanding that you can have both. You can be taking tinctures and also taking medications, you know, like provided they're all safe to be taken together. Like, I just think the judgment around taking medications is just, there's no place for it. It's not fair. People don't take time to understand why somebody might be taking a medication that's actually helping them. Sure, there are lots of side effects and stuff, but anyway, I'm not going to ramble about that. But I just feel like I really wanted to say that because I get a lot of judgment from people and it puts you off trying to find other help. And I think your other question was about like what friends can do. Obviously, that was a very short-winded like description of what medical professionals can do. I feel like we could do a whole podcast on that subject itself, but I hope that was like a bit helpful. But yeah, with like friends, and sort of people in my community, I think one of the biggest misconceptions is that like I need more help than they can give. What happens basically is that, or sometimes, not obviously all the time at all, but like sometimes what happens is, say I've been in hospital, I've been especially unwell, or I've had an operation or whatever, like people will think that I'm wanting a lot more help than they can give. And so they don't show up at all. And then everybody feels upset, you know, like they feel shit about themselves. I feel sad and let down and hurt and like a bit abandoned, like, and confused. And I've now learned this is a pattern. And don't get me wrong, like I completely understand what happens in the sort of like misunderstanding. But now I try and sort of reassure friends that literally if someone can just pop, like, of course, sometimes I need like help cleaning my kitchen is amazing if someone can do that, or bringing me food, that's amazing too. But if people can't do that, which a lot of people can't, they're overwhelmed with kids or work or both, or their own health or whatever, like literally a text message means the world to me. Like, I'm very easily pleased. Like, I'm a cheap date. Like, a text message, like a phone call, a voice note, like coming around for tea in my bed, or visiting like me in hospital, or even if you can't visit me in hospital, like send me a message, like just let me know that you're thinking of me. Like all those things. I think people don't realize how excruciatingly lonely chronic illness is. Like, you know, most other people are out at work, seeing people, like engaging with people or their family or whatever. Like, of course, I see, you know, a good amount of people in my life because I've got amazing friends, but it's still incredibly lonely because 90% of my life is spent on my own. And when you go to hospital, it's sort of 10 times that. And time is just, when you're chronically ill, like in bed a lot, time is just totally different to me than it is to someone who doesn't have chronic illness. Like, the days are so long, the weeks are so long, like, and so to break that up with just a cup of tea or just someone checking in with a text, like, it means the world. And I think that people who don't have chronic illness, like, put a lot of pressure on ourselves due to our fucking society. Like, there's not enough community support in our society, first of all. So then individuals feel that it's down to them to like support me in these big ways, and that I need like a lot and stuff. And don't get me wrong, like I do need a lot of support that I don't have, and that is a problem. But that's not like my friend's responsibility, obviously. Like, and I try, so I've since learned through a lot of like trial and error to offer like as much reassurance as possible that I don't need my friends to fix my situation. I just want connection. Like, literally, I don't mind if I live in a fucking tip, if it means that I have a text message or a phone call or a cup of tea with someone. Like, obviously I have the amazing friends that I do that sometimes do come and clean up for me or like bring me food, and that's incredible. But that's like a complete bonus. Like, the most important thing for me, everybody's different, but for me it's like, it's connection and to not feel forgotten about. And I think, to go back to what we were speaking about at the beginning about the grief, something you feel a lot. So when you have chronic illness, sort of almost no matter how much connection you have, you feel forgotten about it. I think it's a chronic symptom of chronic illness, like because everybody's out there living their lives. And this is how it feels. I mean, everybody's out there living their lives and you feel forgotten about and you feel behind everybody because you kind of, I don't, maybe it's harsh to say you kind of are, but like I kind of am, like from society's viewpoint, I am like, that is my situation. And I challenge that. Like, I don't believe our worth is in what we do and how productive we are and all that bullshit. But we do have to also see that we live in the society that says that is our worth and that is our value. And so I think that, the most important thing that friends can do to support someone with chronic illness is communicate and connect. And I think the other best thing that people can do is that to ask someone what they need. So like, and to be really clear with your limit, like I don't want friends. I've had friends that have helped me to their detriment and got burnt out and then just disappeared from my life. And that's not what I want at all. Like, I really love it when people say no, because it means that I can trust them more. And like, it means that I know that if they're helping, they really want to help and they have checked in with themselves and they're not going to get burnt out and resentful, because that just doesn't help anybody. So I'll stop there because that was a long-winded answer, but I don't know if that was helpful.
Yeah, no, that was amazing. And I think I wanted to add that, like, often I think when you're experiencing chronic illness, like, the world makes you feel like you're a burden, right? So you feel like you're extractive or something on other people's time and energy because you need care and support. Like, I'd need my stepdad to drive me to hospital, or, there was a point where I like couldn't even lift up a plate, like, because I was in so much pain, and like I'd need help with cooking. And it's like you kind of get used to like being defaulted to that position, but it's like very disempowering to be in that position. And I think it's worth naming with you that, like, despite what you go through, like with your health, like, you're such an incredible friend. Like, you're so consistent and loving, and like, just like order me flowers or like order me little gifts, and like, how was your prison visit, and like, how are you feeling? And it's like, it's not like a one-way thing. Do you know what I mean? And I think that's what gets me with chronic illness, is like, just because someone has an illness, like, that isn't the totality of who they are, right? And what they can give to the world. And like, like, you're so creative and you've like supported so many people who are like navigating this stuff, who are just like fucking lost and terrified, like, especially with your Instagram and people who have like the grief around having like hysterectomies and things. Like, I think, like, it, like, it isn't about like worth or productivity, but I think it is also worth naming that, like, you can still give so much, right? Like, in terms of like, people can still receive so much love and care from you. And obviously there's times when you really need it, like if you're in hospital, but like you said, like, it's kind of, it is give and take. And I think like when it is a more like collective thing, like, it does feel, more kind of like nourishing or liberating somehow. But I just want to thank you so much for your time. And like, let's definitely do some other interviews about, like, organizing ableism in general, and like, navigating like the hospital, like medical system. Like, I'm sure we could talk about a million and one things, but I just wanted to ask if there was, anything else you wanted to share today before we finish.
I think we could speak for hours. But I think I just wanted to respond to what you just said. Is that, like, thank you so much for saying that. Like, it means a lot and it made me tear up. So I really appreciate it. And I think that that's what I kind of want to finish on, is that something that people without chronic illness, if you're friends with someone who has a chronic illness, something that can be just such a gift to us is when people notice the way, like, all that you just said, like when people notice the ways that we give. So I can't do the things I want to do for people. I can't go and, I don't know, whatever they are, like acts of service, right? Like, one of my love languages is acts of service, but I can't do that. And so I show up with other ways that I can do, whether it's like, like emotionally supporting someone, or like checking in, or remembering things, whatever it is. And I think, like, with friendships, like, I'm so grateful to have the friends I do, because they they see the ways that I give. So it's a balance, rather than when you, like you say, when you have chronic illness, you can feel like such a burden, and I like a sort of like, you feel like you're a drain on people, and that you have to like pretend you're a lot more okay than you are, which I do all the time, to be honest. Well, not all the time, but like a lot of the time. But it's just, that can be very exhausting. And I think I want to like finish on sort of saying to people that might be listening with chronic illness, like, you're not a burden. And if you haven't found your tribe of people that understand that, like, you will. Like, I didn't used to have people that noticed the ways that I give, and sort of the ways like felt like it was more one-sided. And I obviously, it didn't work out in our friendships. But I think also I hadn't understood what I needed from people. And now I feel like I've got to a place of having really great friends around me who, like you just said really beautifully, like, is noticing the ways that I do show up and give and try to show up, and to like, I just feel like people with chronic illness need to remember that it can be incredibly lonely, and it can be really hard to find your tribe of people when you can't leave the house most of the bloody time. But they are out there, whether it's through social media or whatever it is, or through sticky conversations. Like, I've had friends who I haven't known whether we could get to a place of, understanding each other. And then actually all we needed to do was like communicate about it. And I think for people who want to support someone with chronic illness, like, start the conversation, because it's very hard when you're the one living with these things to know whether people want to go there. And I think if you can start the conversation, like, it literally can change a life and save a life. Like, if you want to try to support your friend with chronic illness, like, it just, when people do that, it just makes me feel so much less isolated. So sorry, my brain and my cognition has completely crashed. So I have no idea if I just made any sense.
No, you did for sure. And like, this was, definitely a huge like use of energy, and I hope you can have a rest now and watch some good trash. That's the other good thing, is that we have good trash recommendations because of both having like long periods of like being in bed. But I just wanted to say thank you so much for your time. It's been amazing. Like, I knew it was going to be moving because you're so articulate and powerful as a speaker and a writer. And if anyone has ever ordered the medicinal herb colouring book, that was a project Amani and I did together. And Amani did all the incredible illustrations, and kind of funds from that, like, we split it, has kind of gone to prisoners, and then also for various kind of like healthcare costs and stuff over the long haul. So thank you if you've supported that book. It's still for sale. And maybe Amani, you can let me know any links you'd like me to include, and I can put them in the show notes in case people want to follow you on social media or read some of your writing and things. I just want to say thank you so much again for your time. It was amazing.
Oh, thank you. I love you to bits, and I'm so glad we could.
I love you too, babe.
Thanks so much for listening to the Frontline Herbalism podcast. You can find the transcript, the links, all the resources from the show at solidarityapothecary.org/podcast.